I just want someone to hear my voice. I'm in agony, and I am not alone, expressed an Afghan university student, her eyes welling up with tears. A significant number of girls in my class have contemplated suicide. We are all grappling with depression and anxiety. We have lost all hope. This young woman, in her early 20s, attempted to take her own life 4 months ago, following the Taliban government's decree in December of last year barring female students from attending university. She is currently receiving treatment from a psychologist. Her words shed light on a less visible but pressing health crisis unfolding in Afghanistan. We are witnessing a pandemic of suicidal ideation in Afghanistan. The situation has reached unprecedented levels, yet the world rarely acknowledges or discusses it, states psychologist Dr. Amal. When you read the news, you come across stories about the hunger crisis, but mental health is seldom mentioned. It's as if people are slowly being poisoned, losing hope day by day. Welcome to Slant News. If you want to support, you can subscribe to our channel. Thank you. Please note, in order to protect their identities, the names of all individuals interviewed in this news video have been altered or withheld. Dr. Amal reveals that she received 170 distress calls within 2 days of the announcement prohibiting women from attending universities. Presently, she receives an average of 7 to 10 new calls for assistance every day. The majority of her patients are girls and young women. Even before the Taliban takeover in 2021, Afghanistan, deeply entrenched in a patriarchal society and burdened by 4 decades of war, faced significant psychological distress. The United Nations estimates that half of the population, mostly women, experienced such distress. However, experts informed the BBC that the situation has worsened considerably due to the Taliban government's crackdown on women's rights and the country's economic crisis. Initiating conversations about suicide proves exceedingly challenging, but 6 families have bravely shared their stories with us. Nadir is one of them. He discloses that his daughter tragically ended her life on the first day of the new school term in March of this year. Until that day, she firmly believed that schools would eventually reopen for girls. She had been certain of it. But when that hope was shattered, she couldn't bear it and chose to end her life, he reveals. She loved school. She was intelligent, compassionate, and aspired to study and contribute to our nation. When schools closed, she became extremely distressed and cried incessantly. Nadir's pain is evident as he speaks. Our lives have been shattered. Nothing holds any meaning for me anymore. I am at my lowest point. My wife is deeply disturbed. She cannot bear to be in our home, the place where our daughter took her last breath. We have connected Nadir's family and others mentioned in this article with mental health professionals for support. The father of a young woman in her early 20s shares what he believes led to his daughter's suicide. She aspired to become a doctor. The closure of schools devastated her and left her distraught, he recounts. But it was when she was denied the opportunity to sit for the university entrance exam that she lost all hope. The loss is unbearable, he adds, his voice quivering with emotion. Similar stories emerge from other individuals, girls and young women struggling to cope as their lives and futures come to a grinding halt. We speak with Meher, a teacher who reveals that she has attempted suicide twice. The Taliban's decision to close universities for women resulted in me losing my job. I used to be the main breadwinner for my family, and now I can't afford the expenses, she shares. Being confined at home, I faced immense pressure to get married. All the dreams I had for my future shattered. I felt completely lost, devoid of purpose or hope, which led me to attempt to end my life. Our investigation into this crisis began when we came across multiple articles in local news portals reporting suicides from various parts of the country. The situation is catastrophic and critical. However, we are not permitted to record or access suicide statistics. Nevertheless, I can confidently say that it is rare to find someone in Afghanistan who is not suffering from a mental illness, explains Dr. Shan, a psychiatrist at a public hospital in Afghanistan. A study conducted in Herat province by the Afghanistan Center for Epidemiological Studies, released in March of this year, revealed that 2/3 of Afghan adolescents exhibited symptoms of depression. the United Nations has raised an alarm about widespread mental health issues and an escalating number of suicides. The Taliban claims that they do not keep records of suicide cases and did not respond to inquiries regarding a surge in such incidents. Due to the associated stigma, many families choose not to report suicides. In the absence of official data, we have attempted to gauge the magnitude of this crisis through conversations with numerous individuals. Being stuck at home without education or a future makes me feel utterly hopeless. I am drained and apathetic towards everything. It's as if nothing matters anymore, shares a teenage girl, tears streaming down her face. She, too, made a suicide attempt. We meet her in the presence of her doctor and her mother, who refuses to let her daughter out of her sight. We inquire why they chose to speak with us. Nothing can be worse than this, which is why I am speaking out, the girl asserts. And I thought that maybe if I speak out, something might change. If the Taliban will remain in power, then they should at least acknowledge our existence. If that happens, I believe they would reopen the schools. Dr. Amal, the psychologist, emphasizes that while women have been particularly affected, men are also impacted by this crisis. In Afghanistan, men are raised to believe that they should be strong and powerful, she explains. But currently, Afghan men are unable to raise their voices. They are unable to provide for their families financially. This greatly affects them. Unfortunately, when men experience suicidal thoughts, they are more likely to succeed in their attempts due to the nature of their planning. Given this challenging environment, we ask Dr. Amal what advice she offers to her patients. The best way to help yourself or others is by not isolating yourself. Reach out to your friends, visit your neighbors, form a support network that includes your parents, siblings, or friends, she advises. I ask them who their role model is. For example, if Nelson Mandela is someone they admire, I remind them that he spent 26 years in prison, yet due to his values, he survived and made a difference in people's lives. That's how I attempt to instill hope and resilience. As Afghanistan grapples with this mental health crisis, it is crucial to shed light on the urgent need for support, understanding, and resources to address the silent suffering of its people. The pandemic of suicidal thoughts and the loss of hope must not be overlooked. The world must come together to offer aid and alleviate the burden on a nation already burdened by war and instability. In the face of immense challenges, there is still room for hope and resilience in Afghanistan. In the midst of darkness, there are glimpses of hope and resilience that can guide Afghanistan towards healing and rebuilding. It is the collective responsibility of the global community to extend a helping hand, listen to the voices of those in pain, and work together to restore hope, dignity, and a sense of purpose to the Afghan people.